Hello and welcome to another episode of How to Citizen. This is episode 2. I'm Meghnad and this is Shreyas, my co-host and cousin.
Absolutely. Thank you. Thank you for that lovely introduction.
Yeah.
We are here from Kashmir. You're seeing us. We are back to the studio because it wasn't safe for us to go anywhere else. So we have come back to the studio.
In Bombay.
Yeah. You want to tell the address? No.
We should tell the address. आ जाओ ऑफिस में आ जाओ तुम लोग तो बस बात करने
आ जाओ.
And today we are doing chapter 2 of the 7th grade civics book. In case you missed the first episode, you can go watch it. But this season we are doing 7th grade. Like last season we did 8th grade. Society is regressing, so are we. And the title of the chapter is Role of the Government in Health. And we have a very, very fun and unexpected guest with us, to be very honest. Hello Anup Soni.
Hello Meghnad, hello Shreyas, how are
What's
you?
happening?
मैं बहुत तैयारी करके आया.
And so you must have seen him in
Everything.
Everything.
Yeah.
Everything. So he was in Crime Patrol, he was in CID Special Bureau as ACP Ajat Shatru.
You like the sound of that name?
I want to say it
Ajat
again
Shatru.
and again. So it's such a nice name. And also, so my mom is a big fan of Balika Vadhu.
Oh.
Right. And of course
चलो
you were
कुछ
in
तो
it.
change हुआ cop वॉप से.
And the thing is, my mom started watching Balika Vadhu and then I got very much into it as well. So I have seen you intensely in Balika Vadhu as well. So I'm also a secret Balika Vadhu fan.
Yeah.
So as by extension, you're fan then.
No, even at my house, Balika Vadhu, every night for years, it was like a regular staple. And my grandmother is, she has lost her hearing. But she refuses to wear a hearing machine. So she has actually watched the show basically on mute. Like the last 4 years. So I have no idea what story she thinks, what your role is. In her head is completely different. But you have been a part of that.
But you know that Balika Vadhu starts at 12 o'clock every day on Colors and ends at 6 o'clock. 6 hours every day. You can watch now also when you go.
Wait, what?
Yeah.
Oh, wait, are they playing it on loop now?
I don't know because I went to my mother's house. She also lives in Bombay and I was like, ये क्या चल रहा है? And then I saw myself. I said, she said, हाँ ये तो आता है. I said, आता मतलब? She said, हाँ 12 बजे शुरू होता है, शाम को 6 बजे तक ये चलता है. I said, my God, man, 6 hours. So that means all the 2000 episodes they'll cover in I think 1 year. Maybe.
Easy.
Wow.
Yeah, because it was half an hour slot. So
Wait, how many years was this show running?
see, the show started in 2008.
Yes.
And it ended in 16, but I quit around 2014. I did it for 6 years. Yeah,
Did they
6
kill
years.
you off? I remember.
No, I went to USA to take care of my Masi. Because I was actually got very busy. You know, I always say that, 10 years of my life as an actor has gone into Balika Vadhu and Crime Patrol. Because
Right.
2008 Balika Vadhu started, 2010 Crime Patrol started.
Right.
And both, I should be thankful as far as work is concerned.
Yeah.
Both did really well.
Correct.
But by 2014, I realized that I not being able to manage both the things. And
Oh,
because
wait, you actually went to the US to take care of your Masi?
in the story.
In the story. I was
So
wondering if
I told them, I said, I want to quit. He said, क्या करें? तो I said, देख लो क्या करना है. So they didn't want to kill. होता है ना कि यार बाद में अगर आ जाएगा तो बुलाना होगा तो ये. So story में कुछ ऐसा था that फरीदा जलाल जी, she's my मासी.
Correct.
I remember. Yes. The
तो
fun
बोला वहाँ
Masi.
भेज देते हैं. So coincidentally, the girl who was playing my wife also decided, because I think she had a kid at that time only.
Right.
So she also decided कि नहीं यार मुझे लग रहा है ब्रेक ले लूँ. तो she said मुझे भी छोड़ना है. तो उन्होंने हम दोनों को अमेरिका भेज दिया.
But thank you so much for doing this with us, Anup.
No, I'm happy to be here.
Yeah.
I'm really happy.
And so we are reading this chapter, Role of the Government in Health. What were your first impressions?
When I was in school, the civics में, that age is very tender, na? And
Yes.
I'm talking about, when I was in school, it was late 80s.
Yeah.
Before 90s also.
Right.
So in
right.
7th standard, what year was it for you?
1983.
Oh, wow.
World Cup time.
Interesting. So 83. Go on.
83.
You were telling us.
So, exposure obviously was very different in those days. So, हमारी civics की books में लिखा हुआ था, एक chapter आया, and there was some drawing and graphics were made in the book, and it says that कि भारत में हर पता नहीं आई मे बी रॉन्ग 2 सेकंड या 3 सेकंड या 4 सेकंड हर 5 सेकंड में एक बच्चा पैदा होता है। तो हमारा क्लास में जोक बन जाता था सर, अभी देखिए एक और हुआ, अभी एक और हुआ, अभी एक और 5 सेकंड, तो एक अलग ही लेवल पे जोक चलते थे। सो हाँ, मतलब ये याद है कि सिविक्स में कि मुझे इतना याद है एरिया कितना होता है, किसी स्टेट में कितनी पॉपुलेशन है, यू नो वी यूज्ड टू लर्न ऑल अबाउट दैट। बट यस, दिस चैप्टर आई think was not at my time. I have a feeling
there.
right because in this detail I read this chapter yesterday when you sent me, but I feel ऐसा तो नहीं था.
And what sort of student were you? Were you the class clown? Were you sincere? Were you a backbencher?
No, I would say that what you said in the beginning, na, that you must have seen him everywhere.
Yeah.
So I was like jack of all types.
Right.
I was never a master of one, but yes, you know, I was not a very studious student also, but I was not very bad also.
Correct.
But at the same time, I'll participate in sports, theater activities in school, in everything.
Right.
So मतलब अगर क्लास में 2 गैंग्स होते हैं ना, एक थोड़ा सा शाई टाइप वाला है या थोड़े से what should I सेंट्रल स्कूल में ऐसा होता है, हाँ, थोड़े से boisterous और थोड़े से extrovert, or maybe a class difference also.
Right.
So I gelled with all classes.
Right.
So स्कूल में आज भी जो मेरे दोस्त हैं, when लॉकडाउन में स्कूल का ग्रुप बना, तो 2 ग्रुप में, एंड ऑब्वियसली यू नो वी आर टॉकिंग अबाउट व्हाट 80s लेट 80s के हम पास आउट हुए हैं स्कूल से।
करेक्ट।
सो जब ग्रुप बना वी गॉट कनेक्टेड अगेन, कुछ से तो थे, बट ग्रुप्स में विद इन लाइक 1 day we came to know that boss the class difference is still there. It's still there.
Yeah. No, but that's actually a very interesting observation as well, right? Because Kendriya Vidyalaya mein hamare, I mean, obviously at least in that school, because government servants and all those kids come, there is a very noticeable class difference that you can see also.
And especially when there are kids from defense background.
Yes.
There is the household atmosphere is different where they come from. The upbringing is different.
Correct.
So if one guy his father is in a government job but on a very high post, but at the same time there's a guy whose father is on a low post, or maybe in a very different kind of an government setup.
Absolutely.
So there is a class difference.
Correct.
And also very multicultural now that I think of it, because in your class, for example, there must be kids coming in and out all the time.
Yeah.
है ना?
So ऐसा नहीं है that, you know, it's like for example, if you are in Jaipur, so there are students who are from Delhi also,
Exactly.
because the father got posted, or maybe उनके roots Delhi में थे, and
Correct.
so yes, multicultural, definitely.
Multicultural. Oh, that's a very good, I think, way to grow up also in India.
Yeah.
I feel like that's a great atmosphere. What did you think? Did you like school?
I liked Kendriya Vidyalaya. I really liked, because I thought that there was a balance of certain cultural balance, and at the same time, you know, when we start talking about the class difference, you know, you can understand.
Right.
Obviously, if you take it in the right atmosphere. Like,
Correct.
For example, I used to go by cycle when I was in 11th.
Right.
But there were few guys who used to come by bike. Yamaha की नई bike आई थी, RX100.
RX100.
So I was like, but I knew that, you know, I know if I tell my father, he'll buy.
Yeah.
I knew that he can afford,
Correct.
in the sense, but right now, that will not be his priority.
Correct.
I could understand that.
Correct.
So that was okay for me. So, you know, I'll take a ride with my friend. कि चलो यार तेरी बाइक चला लेता हूँ आज मैं.
Right.
So I think I kind of grew up in a very practical atmosphere. And I don't know how, but I've always been a guy who observed and grasped very easily certain things and understood at a very young age. So, you know, my father always used to say that मैंने पूछा था कि मैं एक्टर बनना चाहता हूँ, तो he said, यार whatever you do better than me. So, you know, I could understand that. I said, I promise you that whatever it is, I'll do better.
That's actually a great way to put it. So the school that we went to was a private English medium school. So we didn't have that much diversity in Nagpur.
Acha.
We are both from Nagpur.
Okay.
Now I live in Delhi. He lives in Bombay. But the school, we went to the same school, but it was a very sort of an elite school in the city, right?
Okay.
So it was not this kind of environment. First impressions on the chapter when you read it?
I felt sad.
You felt sad? Why so?
There is a lot of stark truths
Correct.
in reality, you know.
Yeah.
Reading things on paper is very different from
Right.
what
What's
the reality
the ground
is.
No, absolutely. And
So I was...
you know, in so many chapters that we are dealing with in 7th standard, even in 8th standard, we often ask this question कि ये 7वीं के बच्चे को सिखा रहे हैं. I didn't pay attention in civics, to be perfectly honest. I often wonder what kids are thinking now, especially with the pandemic. And if you have this chapter which is coming in, right? It's like something is happening around you which is extremely tragic, and it is actually a chapter on government's role in health. And in a lot of ways, they are failing somewhere. They're successful, vaccines, etc. And now this kid is actually learning about this and seeing it in action. That is what I often wonder. Like, you know, like what is the practical application of this? Do you think there is any practical application of this?
You know, if I like to conclude in nutshell, it's all about the intent. Because see, if a 7th class student or an 8th class student is reading this chapter, he may be just ratifying the whole thing because he has to give an answer.
Correct.
Say for example, if the question in examination is what is the role of government in health sector, लिख दो. अब वो implement हो रहा है. He's not at that stage. He's not bothered about whether it's being implemented or not.
Correct.
He doesn't care about that.
Absolutely.
Yeah.
And what is the total strength of public hospitals and private hospitals in the country, and what kind of facilities public hospitals are supposed to, you know, this happens when you practically face it in your life.
Right.
So I always feel that people who are working in this sector, government, private, wherever, if the intent is right, you know, things can be better.
Correct.
Things definitely can be better.
Right.
I would like to sort of add to that a little bit, because you know, you're absolutely right. You know, like ratify करके हमको एक उल्टी करना है basically paper पे. But you know, I think that's why we are also doing this podcast, right? Where we are going back to 7th grade and reading it, because in so many ways we are now seeing that this is very stark truth.
Yeah.
As you say, they're not mincing words at all.
That's what I'm saying. I was sad when I read the chapter, because at this age, I am not reading it because मुझे कल एग्जाम देना है. I am reading it कि यार ये implement हो रहा है.
Right.
Exactly.
The reality is different around me because I am at that age.
Yeah.
I see people around me. I work with different class of people. I see their scenario, their living standards, everything.
Yeah.
You know, I know. अभी मेरे लिए तो recent example है. You know, my chauffeur, my driver was had some issues and he said that.
Yeah.
That, you know, मैं चला जाऊँगा hospital ये वो. I said, I have given you an insurance.
Yeah.
He said, आपका insurance तो 2-2.5 लाख 3 लाख का है. अगर मैं जाऊँगा private hospital में, they will exhaust me like this. उनको पता है जितने का है वो तो सर उसके ऊपर होगा तो फिर मैं कहाँ से दूँगा.
Oh, that's true.
So I was like, हाँ ये बात भी सही है यार, चलो मैं insurance. But then 3-4 days, 5 days, 6 days, I kept calling him. He took a break. He said, I need a break. Let me just do my tests.
Right.
For 5 days, I kept checking on him. I said, क्या हुआ? सर वो एक आया है रिपोर्ट, दूसरा अभी लिया है, परसों बुलाया है, ये किया है. I said, यार बट प्रॉब्लम क्या है, कुछ पता चल रहा है? ये जो हुआ है तुम्हें, जो भी सिम्टम्स हैं, व्हाट इज? He said, नहीं वो उधर बोला है, वो उधर वाले हॉस्पिटल में जाओ, इधर वाले. तो मैंने कहा, सर आई एम फीलिंग फाइन, बट थोड़ा ऐसा वीकनेस फील हो रहा है और कुछ. सर तो सर वो लाइन बहुत लंबा होता है, ये होता है. देन I said, यार it's high time, मतलब whatever I can do. I spoke to somebody which was a kind of charitable,
right.
And I told them, I said I have insurance for him. So अरे आपने पहले क्यों नहीं बताया? अरे भेज दो उसको. So they kept him for 7-8 days. He's fine now.
Yeah.
And obviously थोड़ा charitable था, organization थी, तो उनका prices कम थे.
Correct.
But they recovered their money from the insurance.
Right.
Correct.
Finally, in 9 years he's been working with me. This is the first time we have used the policy. But then I realized, I said, यार हजारों लोग होंगे ऐसे.
Yeah.
Actually,
And it needed your intervention for it to be fine.
Yes. अगर नहीं होता तो वो महीना भर भी, अभी his work, he's with me, he's down now. उसने ज्वाइन कर लिया वापस काम 15 दिन के अंदर. I only told him after कभी, I said to take 1 week का रेस्ट, आराम करो, और फिर उसके बाद आओ आराम. नहीं तो ये चलता रहता है यार.
No, so I just want to ask you, like the first sentence of this chapter only, which says that in a democracy, people expect the government to work for their welfare. Do you think there's any truth to that?
They expect, see, there are, वही वाली बात है, people who can afford it, they don't care. They don't depend. I feel people who are in a situation where they know that, we can manage on our own, they can buy a good health policy, and they can afford to go to a private hospital, they don't expect anything.
That's true.
I have a feeling that in today's time, from any government, they don't expect anything.
Correct.
ठीक है. प्रॉब्लम ये है कि जिनको नीड है, उनका एक्सपेक्टेशन होता है, लेकिन वो एक्सपेक्टेशन के लिए वो क्या कर सकते हैं, वो पूरा नहीं होता. They can't raise their voice and they can't come on streets, and that's what I said in the beginning only. I always feel that people who are sitting on a certain position, if they have the right kind of intent, things can be better easily. See, we can have different logics. Obviously, our population is so
very
much.
high.
हमारे resources उतने नहीं हैं. सब कुछ है. मतलब I feel it's the population, and then it comes down to your education, because you can't educate everybody. You can't give good health facilities. You can't give other things, food. But still, I would say, जैसे if I am supposed to take care of a certain health sector in my area, whether I am a politician or an government officer, and it's under me, if my intent is right कि नहीं यार, ये government का पैसा है, यार ये इसके लिए बनाया गया, इन लोगों के लिए, यार इन लोगों के लिए कर देते हैं.
Correct.
नहीं है वो.
क्यों
नहीं है वो?
Yesterday I was on a Twitter space, okay, where ये आर्गुमेंट चल रहा था कि गवर्नमेंट ने वेलफेयर देना चाहिए या नहीं देना चाहिए. यहाँ से ही तो शुरुआत होता है बेसिकली कि अरे गवर्नमेंट इतना कुछ फ्री में दे रहा है, रेवड़ी बांट रहा है, जो बोल रहे हैं, लेकिन इतना फ्री में जा रहा है, ये हो रहा है, वो हो रहा है. एंड the one thing that we started talking about was also unemployment. The reason why people want permanent jobs in government is because of the benefits that you just mentioned, right? Like the insurance, the stability, कि हमको income आ रहा है, हमको government hospitals में access मिलेगा, जल्दी मिलेगा, all of the benefits that come with it. It's so sad that the government has to become an employer to actually make sure that welfare reaches at least some level of people, right? And of course there is welfare like food, health, education, सब कुछ है. But the larger argument is that government ने welfare देना भी चाहिए कि नहीं देना चाहिए. अभी ये बहुत बात हो रहा है actually आसपास में. What do you think? Is that a argument that we should even have?
We should have, because the answer is clear. Yes, absolutely. The
but
government
then it's not an argument, right?
Yeah.
But no, I feel that welfare, जैसे I always feel that कि अब I don't know, मैं क्योंकि I'm not an expert to say anything on this, but I feel that, for example, if we are talking about health sector, so now any government, I'm forget about
parties
छोड़ government, क्योंकि जो रूल कर रहा है वही government,
correct.
वो government का अगर ये जो उनके अगर सिस्टम में ये है that government is supposed to provide good health facilities in states or wherever, आप उसके लिए होता वो सब है,
right?
But उसका जो इम्प्लीमेंटेशन है, अगर आप देखें, फॉर एग्जाम्पल मोस्ट ऑफ द गवर्नमेंट स्कूल्स और गवर्नमेंट हेल्थ सेक्टर्स जैसे, अरे वहाँ तो डॉक्टर ही नहीं है, वहाँ तो बेड भी नहीं है, या नहीं है, बेड बहुत गंदा है, या ये है, वो क्यों है?
Right.
Because people who are working अब now, even a sweeper who's working in a government clinic, he knows that मेरी नौकरी है यार.
हाँ, बिल्कुल.
And I'm not talking about politicians, I'm talking about people who are working. I always say that, we talk about our rights, but I think there are certain duties also.
Yeah.
भाई अगर हमारे देश में जैसे हेल्थ सेक्टर में एक बहुत बड़ा रीजन है that cleanliness. अब स्लम्स हैं हमारे यहाँ, लेकिन यार स्लम्स में भी रहने वाले लोग अपने आप को थोड़ा सा तो बेटर रख सकते हैं. They have decided not to take, they don't bother. I have seen nalas around. Bombay में तो slums are everywhere.
Yeah.
Here you have a building where the flat is 10 crores and then on the next side you have a तो वहाँ पे आप देख लो nalas with plastics and
but
everything.
I don't know if we can assign the blame of that to the people living in the slums. Like I think that's again where welfare comes in, not just in terms of giving things, but giving facilities, providing education, and educating them that this is not you shouldn't do this.
No.
Or
See,
even
it works both ways. I always feel. Maybe balance is different.
Right.
Maybe say for example, we say that for a government to provide a good health facility is important for them. 70% of job they are supposed to do. But I think 30% is to be done by the other side also. So it goes on a different level. For example, say a simple rule here, red light crossing. It's very simple ना.
Right.
रेड का मतलब है रुकना है,
Correct.
ग्रीन का मतलब है चलना है.
correct.
लेकिन कहाँ होता है?
Yeah. True.
मेरे दो थियरीज है इस पे, लाइक क्लेanliness पे स्पेशली, एंड इट्स ऑफ कोर्स रिलेटेड टू हेल्थ ओनली. सो फॉर एग्जांपल यू हैव अ हाउस एंड यू कीप योर हाउस क्लीन, you know, like but your, you know, ownership of the house and the cleanliness ends at your door या
Exactly.
कंपाउंड, राइट?
Exactly.
हमारे यहाँ पे यही मेंटालिटी है कि and सब में है कि ये कंपाउंड के इस साइड में जो भी है वो मुझे साफ रखना है, बट उसके बाहर मैं कुछ भी फेंकूंगा या फिर कुछ भी करूंगा.
सही है, exactly.
And the interesting thing there is that I mean, of course, you've traveled abroad and everywhere. I feel like वहाँ पे ना एक थोड़ा सा ओनरशिप रोड्स का भी है कि ये रोड भी तो मेरा ही है.
Yes.
ये सोसाइटी पूरा मेरा है. तो हमारे यहाँ पे एक तो स्पेस का प्रॉब्लम है, लाइक आवर हाउसेज आर वेरी स्मॉल ऑल्सो, सो दैट क्लेनलीनेस इज सो लिमिटेड फॉर अस. तो उसके बाहर जो भी है वो चलता रहता है. तो आई थिंक दैट इज वन फैक्टर विच आई थिंक वी नीड टू ऑल्सो टॉक अबाउट, विच इज ओनरशिप.
बट एक बात बताओ, रोड में खड्डा है और मैं आता था रोज मेरा एक्सीडेंट होता है, मैं क्यों कंसिडर करूँ उसे अपना रोड?
No, but that's the thing now. So unless you consider that as your own personal property also, personal in the sense at least public property, which I actually have contributed to, you will not even bother to fix that. Like तू contractor को क्यों पूछेगा फिर questions कि अरे इस पे ये
But you know, I have a very simple take on this. I feel everybody in this city, in this country, has a role to play.
Correct.
We all have a role.
Yeah.
Now, say for example, if you are going to your office, so you go to your office, there is a certain job you are doing at your
Right.
office. अब वो private sector में है,
Right.
कहाँ पे भी है.
Right.
For example, you are just sitting here.
Correct.
This job is you're doing, you're supposed to do it
yeah.
to the best of your ability.
Correct.
The same way, a contractor or a government officer who's giving a contract to the contractor to make the roads, I think they are not doing their job.
Yeah.
So someone is not doing his job properly.
Correct.
So I always feel that rights and duties go hand in hand. Everybody has to see. हर बात के लिए हम सिर्फ और सिर्फ पॉलिटिशियंस या इसको
गवर्नमेंट को,
यार बता, देखो गवर्नमेंट भी वैसी होती है जैसे लोग होते हैं.
Exactly.
ऐसा मेरा बहुत क्लियर
Yeah.
Right.
वेरी सिंपल. गवर्नमेंट समटाइम नोज दैट ये चल जाएगा.
चल जाएगा, इंफीरियर काम करके चल जाएगा.
हाँ, चल जाएगा.
कोई पूछेगा नहीं हमको.
हाँ, अभी इन अ सिटी लाइक बॉम्बे यार, इमेजिन पीपल हैव द कॉस्टलीस्ट कार,
राइट,
एवरीथिंग, बट कोई भी रोड. अच्छा, अब जैसे मैं इंटेंट की बात कर रहा था, यू गो ऑन हाईवे रोड्स आर बेटर देन द
Correct.
एसपी
Sure.
रोड होगी या
Yes.
कोई इनर लेन्स ले
Yeah,
लो,
yeah.
उससे बेटर होगी.
Right.
फिर उसके बाद आप हाईवे से लेफ्ट टर्न लो टर्मिनल 2 की तरफ, द रोड्स आर 10 times better than.
Yeah.
So मतलब बनाया तो जा सकता है. बनाया तो जा सकता है.
Right.
ठीक है, जूता 10,000 का भी आता है, 50,000 का भी आता है,
Right.
1,000 का भी आता है, 500 का भी आता है.
Right.
ठीक है, हर आदमी अपने उस.
Correct.
लेकिन भाई ये तो रोड है.
Correct.
इस रोड को तो आप चलो ठीक है, हमें T2 लेवल का स्मूथ नहीं दो,
Right.
लेकिन हाईवे वाले लेवल का तो स्मूथ दे दो यार.
इंटेंट होना
हाँ,
चाहिए, as you
intent.
said. हाँ.
प्रॉब्लम ही ये है कि कोई सवाल, मतलब मुझे कभी कभी लगता है, मैं बड़ा मन करता है. माई वाइफ सेज यार छोड़ दो क्रिप करना. आई सेड मैं, हाँ ये बात भी सही कि क्रिप करके मैं कर क्या रहा हूँ. यू हैव टू मूव ऑन. मतलब आप सोचिए यहाँ पे ट्रैफिक में कितना टाइम लग जाता है.
Yeah, that's true.
और एंड यू नो इट हैपेंस बिकॉज ऑफ द रोड्स ऑल्सो, बिकॉज खड्डे हैं, ट्रैफिक
Correct.
स्लो हो जाता है.
Correct.
रेन्स में खड्डा है, रेन है, और स्लो हो जाता है.
Right.
सो इसका मतलब कहीं ना कहीं तो कुछ लोग हैं जो सही काम नहीं कर रहे
नहीं
हैं.
कर रहे हैं.
आई थिंक यहाँ पे फॉल्ट बारिश का है.
एक्चुअली बॉम्बे में बारिश बहुत होती है यार.
I'll just quickly read the beginning of
Sure.
this. It says, in a democracy, people expect the government to work for their welfare. This could be through the provision of education, health, employment, housing, or the development of roads. electricity, etc. In this chapter, we will examine the meanings and problems related to health. You know, this also brings me to intent, which you pointed out. But there is also an element of pride, no? Like अगर ये कॉन्ट्रैक्टर रास्ता बना रहा है एंड इंफीरियर बना रहा है, इसका मतलब ये भी है कि उसको उसके काम पे प्राइड नहीं है कि मैं यहाँ पे बेस्ट रास्ता बना के दिखाऊंगा. ऐसा कोई प्राइड नहीं
का
है.
कोई चक्कर ही नहीं है. उसको ये पता है अगर अच्छा बना दिया तो भाई 2 साल तक क्या करूँगा मैं.
तो फिर अरे 6 महीने में दिवाली आ रहा है, पैसे चाहिए होंगे तो कैसे बनाऊंगा.
मेरा लॉजिक ये है कि यार आप एक ही बार में अच्छी प्राइस दो ना. जैसा हमने कहा कि भाई जूता हर मिलता है. अगर आपको लगता है कि यार ये वाली अच्छी रोड बनाने का कॉस्ट थोड़ा ज्यादा है, खर्च कर दो ना एक बार कॉस्ट. और मैं फिर उसके बाद आप हम ब्लेम कर सकते हैं.
हाँ सही है
कि भाई ये मेरा रोड है. वो जो
correct.
प्राइड वाली आप बात कह रहे हो, से फॉर एग्जांपल वी से ना अब्रॉड में लोग बहुत कुछ है, द लिविंग स्टैंडर्ड्स आर रियली रियली हाई, बट एट द सेम टाइम दैट गाय हु इज वॉकिंग ऑन द रोड और ड्राइविंग ऑन द रोड, he takes pride कि यार it's my duty also to take care of this road because the road is good.
Correct.
The road is good.
True.
and we need to keep it so.
Yeah.
But यहाँ पे if I give you a personal example, right, like your personal example, so you're an actor, you take pride in your job, you make sure that you present the best.
मतलब मुझे अगर कोई ये बोले यार बहुत बकवास काम किया, मतलब मैं डिप्रेशन में चला जाऊंगा.
Exactly. तो मुझे बताओ कि I mean I'm just trying to understand this. It's just a open question here, right? कि now if like we were talking about YouTube comments अभी like थोड़ी देर पहले, right? You were saying that कभी-कभी criticism आता है and then you take it very seriously also, right?
No, डिप्रेशन का मेरा मतलब ये नहीं है कि बट ये होगा कि हाँ यार मुझे आई नीड अप्रिसिएशन बिकॉज
Of course.
बट क्या है यहाँ पे दो चीजें डिफर करती हैं. हमें क्यों अप्रिसिएशन चाहिए? दोनों रीजन से. एक तो ये है कि बिकॉज वी लव आवर जॉब, दैट इज वन थिंग, एंड वी नीड अप्रिसिएशन बिकॉज ऑफ दैट अप्रिसिएशन, एंड इफ वी डू वेल वील गेट मोर वर्क.
बट ये
कॉन्ट्रैक्टर के साथ ये नहीं है क्योंकि उसको मालूम है कि भाई जितना बार खराब होगा, देयर आर पीपल इन द लाइन, दे ऑल विल गेट बेनिफिटेड.
राइट.
तो वहां पे उनका उल्टा है. काम खराब करने से ज्यादा काम नहीं है. हमारे मेरे प्रोफेशन में काम अच्छा करने से ज्यादा काम.
तो प्राइड डजंट फिगर एनीवेयर इन द लिस्ट.
बट अगर कॉन्ट्रैक्टर ये सोच ले कि यार आज मैं गली मोहल्ले के रोड्स बना रहा हूँ, मैं अगर अच्छा काम करूंगा, और अगर वो जो ऑफिसर हु इज एम्प्लॉइंग हिम कि यार ये अच्छा काम करो, हम तुम्हें अच्छा पैसा देंगे, रोड अच्छा बनना चाहिए, we will give you better, bigger projects.
Right.
You know, then it
incentive system है वहाँ पे. हाँ.
Somewhere down the line you need to feel.
Yeah.
अब I don't know about the details, but I believe that there is a lot of subletting happens in these kind of contracts.
That's
so
true.
by the time it reaches the person who's doing it, वो कोई बेचारा बहुत ही छोटा मोटा कॉन्ट्रैक्टर होता है.
Right.
You know, ये बड़े कॉन्ट्रैक्ट्स लोग जो बड़ी कंपनीज हैं वो ले लेते हैं.
Yeah.
So what I mean to say is कि यार डेफिनेटली वी नीड टू आस्क फॉर आवर राइट्स. ड्यूटीज भी तब आएंगे जब राइट्स फुलफिल हो जाते हैं. इट गोज टुगेदर. मुझे कोई अगर आप मुझे बोलोगे कि यार कचरा मत मचाओ, ठीक है, ये यहाँ मैं मानता हूँ मेरी ड्यूटी है. जैसे आई टेल यू, आई गेट सो पिस्ड एंड आई हैव फॉट विद पीपल ऑन द रोड. देयर आर लॉट ऑफ फुटपाथ्स इन बॉम्बे. चलो ठीक है, आई नो 50% फुटपाथ्स आर ऑक्यूपाइड बाय हॉकर्स. जो 50% खाली है ना, उस पर भी लोग नहीं चलते हैं.
Yeah, that's true.
मतलब I am telling you, I am driving and I am like, excuse me, मैं हॉर्न मार रहा हूँ क्योंकि गाड़ी नहीं है, सामने से भी गाड़ी आ रही है. And then I said, यार भाई साहब उधर चल लो ना यार. And then he looked at me and he said कि क्या, अच्छा हाँ ठीक है.
अनुप, उसमें एक प्रॉब्लम है. तो
क्या?
कल मैं एसवी रोड पे चल रहा था एंड कंटिन्यूटी नहीं है फुटपाथ की. कभी
I agree.
एक तो कचरे का ढेर आ जाता है बीच में, नहीं तो फिर कुछ तो भी और आ जाता है.
बिल्कुल सही कह रहे हो. ऐसे I complete, that's what I said. I said that rights and duties वाला चक्कर वही. लेकिन I'm saying कि वो we are so habituated in a certain way of living कि फुटपाथ खाली भी तो नहीं चलते हैं.
Very true.
You know,
very true.
Talking about rights, I want to come to how in our constitution, right to health is not a fundamental right.
Right to life is.
Right to life is, but
which includes health.
But there are, most other countries have right to health as a fundamental right also. And within right to life, Article 39 talks about this, but it only says that, Article 42, it says that there should be just and human conditions, not for human beings, not for citizens, but for workers, and people on maternity leave. So
Really?
so the government only cares about you if you're making babies or if you're working. If you're just a citizen, that's not enough. That's not enough
See,
at all.
for example, we have a clause where, for example, if somebody say for example, because of bad roads, you have an accident and you break your leg or something like that, somebody can file a case.
Oh, there is an example idhar also.
I've read that example. वो चलता रहेगा लेकिन.
Right.
You know, when I was doing LLB after law after my graduation, first year, before I joined National School of Drama.
Right.
So in first year, there was a subject called Law of Torts.
Yes.
You know, Law of Torts. Again, I said fascination, pehla saal law mein, university mein. Law of Torts was very interesting because the cases were very interesting.
Yeah.
Ab Law of Torts is applicable in India also. That's what I believe.
Right.
But when I was reading the cases, I'm talking about like early 90s types, and I was like, ये यहाँ कौन करेगा? So there was this case that there was one guy, he filed a case against the neighbor because neighbor's garden was full of roses.
Right.
और when he comes into his garden in the morning, वो roses से उसको sinus का problem है तो उसको जुकाम करता है. And he filed a case. वो law of torts में चला गया. So then the judgment was that कि भैया number of roses has to be reduced. उसका वो medical analysis हुआ कि इतने roses होंगे तो उसका smell की वजह से इसको ऐसा हो रहा है. उसको भी बोला गया कि तुम भी अपना इलाज वाला करा. ऐसे यार बहुत टाइम है इनके पास. But that's the problem, you know, कि यार यहाँ हमारे यहाँ normal cases ही नहीं होते. No, I have seen I did one case in Crime Patrol where there was this guy. वो बेचारा कोई लड़का था सब्जी वाला जो 200 रुपए से, इट्स अ वेरी फेमस केस, इट्स ऑन यूट्यूब, यू कैन रीड ऑन गूगल आल्सो. वो सब्जी वाले का कुछ एक 200 रुपए की चोरी में वो 11 महीने अंदर था वो. वो फिर अब वो भी यू नो ऑल दीज व्हाट यू कॉल दैट प्रो बोनो केसेस जो करते हैं, जो लॉयर्स हैं, एनजीओज वाले, उनको पता चला किसी ने तो उन्होंने उसको छुड़वाया. और उसको ये भी कहा गया कि भैया से दैट आई एम गिल्टी. क्योंकि अगर नॉट गिल्टी होता तो बहुत और लंबा चल सकता था. बोले नॉट गिल्टी बोलो, 200 रुपए है, फिर सॉरी वॉरी बोल के माफी मांग के नहीं करेंगे.
बट फिर उसको कोई पेनल्टी लगा उसके बाद?
नहीं, कुछ नहीं हुआ वो. तो एनजीओ इज टेकन. बट आई एम सेइंग कि you know, imagine if this kind of a case is lingering on for 11 months and he's in jail.
Yeah, that's crazy.
So I feel there are a lot of issues, but वही वाली बात है. अभी आप population को blame कर लो, इसको blame कर लो. Yes, they all these factors are right.
Yeah.
But मुझे लग रहा है intent का ही गड़बड़ है.
Correct.
I agree.
End of the day वही है.
Intent.
You know, यहाँ पे एक line लिखा है, what is health is the section. It says, all of us would like to be active and in good spirits in whatever we may be doing. It isn't healthy to be dull, inactive, anxious or scared for long stretches of time. We all need to be without mental strain. You know, there are so many studies that are done about how Indians are actually one of the most depressed countries in the world. Like मेंटल हेल्थ के बारे में तो कुछ बात होती ही नहीं हमारे यहाँ पे. एक लॉ पास हुआ था अभी कुछ सालों पहले, बट लाइक आई मीन you know, we view this, and I have heard this many times, you must have heard this, when people complain about like, oh, I have anxiety, or मुझे थोड़ा like I don't feel good, and I don't want to come to office today, etc. There's this attitude कि यार ये तो तुम खुद ही कर सकते हो ना, लाइक 2 मिनट के लिए अंदर जाओ और लाइक रो लो थोड़ा सा, वापस आ जाओ और लाइक कंटिन्यू योर वर्क. एंड do you think that people around you are generally unhappy, like or are they okay? Like what is your feeling?
यार अभी तो मुझे लगता है yes. मतलब if I still feel people living in smaller cities are happier than people living in bigger cities.
Interesting.
That's my observation.
Right.
Family wise also they are happy. They are somewhere, they are, I won't say complacent, but they are okay. जैसे कभी कभी वैसे बोलते हैं ना कि यार ये 9 to 5 जॉब बड़ा बोरिंग है यार. दिस बैशिंग ऑफ 9 to 5 जॉब इज ऑल्सो अ ट्रेंड आई फील.
फॉर श्योर.
यार कुछ लोगों के लिए 9 to 5 इज ओके. दे लाइक स्टेबिलिटी. हर आदमी को अपना स्टार्टअप नहीं शुरू करना है ना. उसको नहीं मैं कुछ इन्वेंट करूंगा और मैं कुछ अपना करियर, मुझे उसको नहीं बनना है। रिच डैड पुअर डैड की किताब पढ़ के भैया अगर आपको रिच बनना है तो आपको खुद ही एंटरप्रेन्योर बनना पड़ेगा। तो बाकी काम जो है वो सब अच्छा शो है वो। कौन सा है वो? शार्क टैंक। सो शार्क टैंक आई लाइक दैट शो, आई रियली लाइक इट। बट उसके लिए ठीक है, उसको देख देख के आप नौकरियां मत छोड़ो यार। काम छोड़ दाड़ के बैठे।
I actually agree, yeah, like there are people who are like, हाँ मतलब नहीं है ambition मेरा, प्रॉब्लम क्या है तेरा? Like
हाँ मतलब ठीक है यार, कोई आदमी अच्छा, उसको अच्छा लगता है घर आना शाम को, और उसको अच्छा लगता है कि संडे को एक मील बाहर खाने जाना है फैमिली के साथ, मुझे मूवी देखनी है। सो yes, but yes, in majority I would say bigger cities people are unhappy. वो मैंने एक स्टैंड अप देखा था, पता नहीं किसका देखा था, जिसमें he was telling कि सर के मेंटल हेल्थ डिप्रेशन की बात हो रही है, दोस्तों से अगर बोलना यार ये मेरा चलना यार दारू पीते हैं यार, हाँ, सब डिप्रेशन दूर हो जाएगा।
The other version of it, दारू पीते हैं यार, सब ठीक कर देगा।
Because I think Indian society doesn't even allow you to be anxious or depressed. यहाँ पे ये लिखा है ना, it isn't healthy to be dull, inactive, anxious, scared for long stretches of time. We all need to be without mental strain. मतलब वो बोल रहे अलाउड ही नहीं है मेंटल स्ट्रेन। तुम निकाल दो मेंटल स्ट्रेन होगा।
No, I mean sure you can read it that way.
7th क्लास के बच्चों के हिसाब से उनको ये उनका मतलब इंटेंट ये होगा दैट कि अगर हो भी तो ज्यादा मत सोचो उसके बारे में, वो दैट इज हार्मफुल फॉर यू।
Just get out of it quickly। और क्या है?
Holy shit, I was so depressed in school, man. Like, इतना मेंटल स्ट्रेन था मेरे पे, मतलब I was a bad student. I was not like you.
नहीं मैं भी ओके टाइप्स था।
No, I was not even okay. I was terrible. I was like in the bottom of the rung type. कभी फेल हो रहा है, कभी नहीं हो रहा है। इतना मेंटल स्ट्रेन होता था मुझे, like टीचर्स तो टॉर्चर करती थी, but you know that's the thing. I think in schools 10% भी नहीं 5% ऊपर के जो लोग होते हैं ना, उनको टीचर का प्यार मिलता है, सब कुछ एक्कोलेड्स मिलता है एक्सेट्रा। 95% जो बच्चे रहते हैं ना, उनको मेंटल स्ट्रेन होता है।
करेक्ट।
तो दिस इज बैड। तुम कंट्री की बात कर रहे हो, स्कूल में तो ठीक करो पहले। Pick 2 situations from the above collage that are not related to illness and write 2 sentences on how they are related to health.
जो ट्रीटमेंट्स है, वो जो ट्रीटमेंट हो रहा है, वो जो डॉक्टर्स हैं, वो तो रिजल्ट है ना, वो तो सोल्यूशन है।
That's true.
उससे हेल्थ प्रॉब्लम नहीं हो रही, उससे हेल्थ ठीक हो रही है।
Yeah, that's true. Related to illness, sure, I'll still give it that.
और एक मुंडन वाला फोटो।
मतलब बच्चे भाग रहे हैं, वो वाला शायद होगा। Like what is this?
ये obviously ये तो भागने से।
But then that might also mean clean air.
And like running physical activity is important for you.
Yes.
And मुंडन में probably वो होगा ना हेल्थ के लिए कि
हेल्थ के लिए obviously cleanliness।
हाँ, cleanliness।
कीपिंग
नहीं, ऐसे तो सारे ही ठीक है,
सभी ठीक है,
किसी को भी नहीं निकाल सकते।
हम इसमें गलतियां ढूंढने का ट्राई कर रहे हैं, बट है नहीं।
मतलब अगर किसी बच्चे ने इसका आंसर ये लिख दिया दैट सॉरी आई डिडंट फाइंड एनी पिक्चर व्हिच इज not related to health, so will he get marks or not?
I think we will. I think हमको argument करना पड़ेगा।
I think he has to give reasons.
Yeah. That's the idea.
What are you talking about? Have you forgotten how schools work? You'll get 0 marks. You'll get 0 marks.
नहीं, टीचर तो आंसर लिख के देगी ना आपको इसका, एंड देन फिर वो रट के आपको फिर वो करना है थोड़ा सा,
वो बताएगी, क्लास में पढ़ाया जाएगा।
बट आई रियली होप, पता है, आई मीन आई होप, आई हैवंट बीन इन अ क्लासरूम इन अ व्हाइल, बट आई होप दैट टीचर्स नाउ सॉर्ट ऑफ आल्सो लाइक डू दीज डिस्कशंस इन स्कूल्स एंड लाइक व्हाट वी आर डूइंग राइट नाउ। आई होप थोड़ा बहुत तो होता होगा।
And if you're not, just like make this podcast a part of your syllabus so that you don't have to do
absolutely.
all that also.
Yeah, absolutely, yeah. बच्चों को सुनाओ, must.
I want to get to the numbers. You want to talk about
numbers? Oh, that's we are coming to that.
That's the sad part.
We are coming to that. So the next part of this chapter is healthcare in India, and I have made extensive notes for this one. You know, यहाँ पे there is this table that they show, right, where they are saying India is the largest number of medical colleges in the world and is among largest producers of doctors. Approximately 15,000 new doctors qualify every year. Right?
Big number.
And then it says in 1991, उसके नीचे there were 11,174 hospitals in 2000. And the number grew to 18,218. मेरा एक बहुत बड़ा कंप्लेंट है ये चैप्टर से। 1991 का डेटा क्यों दे रहे हैं अभी भी? Like अभी if you look at the current data,
I think मुझे लगता है कि सीधे ये बताना चाहिए ना आज कितने।
Exactly my point. And the thing is कि अपडेट नहीं करते।
Yeah, maybe they want to just because we were ruled by other countries. बहुत invaders थे हमारे यहाँ. तो to explain them that how the country grew, develop कैसे हुआ, कहाँ से हम ऐसा होता है ना, जैसे स्टोरी सुनाने में अच्छा लगता है कि मैं पहले गरीब था, फिर मैंने मेहनत की और ये हुआ. तो I think something like that. Maybe they want the children to understand that we were not in a very good situation, and today we are. And
shall I tell you a funny thing? We actually have no numbers, real numbers on how many doctors we have. Like legit, like there is this National Medical Registry. I was doing some research on this. Okay, so as of December 2021, it says that it has 13.1 lakh registered doctors. Right, 13.1 lakh only. But उसमें भी बोला है कि 20% उसमें से either they died, migrated or stopped working. So उसमें से if you take it, so it's like 10 lakh doctors around that much. Now उसमें से भी NSSO says that the registered doctors are 6.7 lakh. तो imagine.
तो बाकी क्या है?
तो बाकी के basically, so that's the thing. So this
उन्होंने admission लिया होगा, पूरा नहीं किया होगा. Because the data must have been calculated on the basis of people who did entered MBBS.
Maybe. Officially अगर enter किया होगा. And the estimate is in 10 years from now, we are going to need 11.6 lakh doctors. So we have to literally double the number of doctors that we currently have, right? According to the current numbers. So it's a little ridiculous that they are putting such.
But there is one more thing in this that most of the doctors who study, and we have good doctors, they migrate, they go abroad.
Oh, they do, absolutely. And currently, actually, we have 90,000 doctors and healthcare workers coming out every year.
It's a big number.
It's a big number, yeah.
What you say is a good point, that like we need to have duties, responsibilities. But as a doctor, just playing the devil's advocate, staying in this country, I feel something towards the country. But if I see doctors being beaten, when patients die, then I'll be like, I'm getting the fuck out of here. क्या करूँ मैं यहाँ पे?
Yeah, I have my mother-in-law used to be in a government hospital, and she used to tell us these stories. And now she's retired. Like she had like these people coming in who obviously like gang wars होते थे उनके यहाँ पे तो. She was in Calcutta, and like there was this place where there was a slum, and like lots of मारामारी, especially during elections. तो मार काट करते थे etc. And when she used to go to this patient and tell them कि listen, you need to let me treat this person, वो चिल्लाएंगे, वो ये करेंगे, वो करेंगे, वो बोलते थे नहीं, इनको तो दर्द हो रहा है, आपको तो पता नहीं आप क्या कर रहे हो. It's like, अरे भैया मैं 30 साल से यहाँ पे डॉक्टर हूँ. What is this? So she's like, कभी-कभी हमको भी गुंडा बनना पड़ता था. Like unless you scold them into it, they will not shut up. They will not. And there are so many cases where nurses got beaten up and like whatever, violent हो जाते थे लोग. People are also super stressed during these times. It's very tragic, like government hospitals ka status. It's improving, I must say, thoda.
What are the current numbers, doctors to population?
So the WHO recommendation is that there should be 1 doctor per 1,000 people.
Okay.
Do you want to estimate how much we have?
यार मुझे तो ये भी कम लग रहा है.
कम लग रहा है. नहीं, हमारे यहाँ पे तो 0.74 per 1,000 है. मतलब we are, I think, 25% below the WHO recommended. Actually, the ideal scenario is that 4.4 healthcare workers per 1,000. Which you're right?
Healthcare means doctor, nurse,
all the staff and everything.
Wait, 1 second. I have slightly different numbers. You said 0.74
per 1,000.
India actually, and I'm quoting the Ministry of Health on this, India actually has 1.17 doctors. So we have exceeded WHO's expectations.
What is your source?
Ministry of Health. I mean, they are counting Ayush doctors also.
Okay.
But that's the number that they have.
So they've just doubled it.
They've doubled it.
So that means they are including Ayurvedic, homeopathic, all sorts of doctors.
Correct.
Do you have any opinion on that?
यार ये तो to each to his own. मतलब आपको क्या सूट करता है ये वो वाली बात है.
Right.
Fair. But modern medicine, let's talk about, maybe that is the ratio that I'm talking about and he's talking about, the traditional, Ayush medicine
I
also.
personally feel that there is a trust factor also which matters a lot. I think in last, I don't know, decade or 10, 15, 20 years, the trust on the doctors, you know, the modern medicine doctors, वो भी break हुआ है. Because somehow people feel that यार cheat करते हैं यार ये. एक problem होती है 10 test करवाते हैं. Doctor told me a term while treating a celebrity or a rich patient.
Oh, there is. Oh,
there is a term for that.
Okay.
He used.
Okay.
I said, so explain me. So I don't know the term, but the thing is कि अगर कोई normal patient है तो उसको ये होगा अच्छा आपको ये वाला test कराओ. They say that a rich person or a rich or celebrity or whatever वो satisfy नहीं होते अगर उनको एक ही test बोला तो.
Oh wow, okay.
So he said we do the same thing. नहीं ये करो वो करो फिर ये करो फिर ये करो.
Sure.
Finally we tell them the same thing what we would have told them on the very first day.
Right.
But then they feel satisfied कि यार this guy is good.
Oh.
And this guy is a doctor who treats a lot of celebrities.
Sure. But you know, that's actually very interesting because I would think कि say I'm a well-to-do person, I would go to like an experienced doctor. जब 20 साल से practice कर रहे हैं etc. अब उन्होंने मेरे से एक टेस्ट करवाई, right? और बोल दिया कि अच्छा तुझे ये हुआ है. I would trust the person because obviously उनका experience भी है. They must have seen thousands of cases like me, so they know the symptoms. They've seen it before, etc. I would trust. Why would I want more tests?
You want some more drama. You want some more options. You know, you don't want to go home just after one test. It's done. You
But
came
isn't
out.
that
I don't know. Maybe you feel कि यार he's not taking my health seriously.
Correct.
I'm a big guy.
Correct.
But
There should be a
so when
detailed
you
study.
go to a doctor, Anup, which camp do you fall in? Would you want
यार
more
I
tests?
definitely want कि सीधे बताओ problem क्या है यार.
Exactly. जल्दी हो जाएगा ना.
Time pass हो तो mentally we are also free ना.
Yeah, exactly.
But I honestly think ये problem सिर्फ ये celebrity doctors के साथ होता होगा. जो normal doctors हैं उनके पास इतने patient आ रहे हैं, इतने overworked है कि उनके पास time ही नहीं है.
That's actually
ये बात
very
भी
true.
सही है. हाँ,
15
ये
test
सब भी
बोलने
सही
का.
है.
That's very true.
Exactly. But anyway, coming back to the trust वाली जो बात थी ना, मैं कह रहा था कि बहुत सारे लोग हैं ना, जैसे I know a lot of people से कि यार मेरे को तो ना ये होता है तो I take this फलाना होम्योपैथिक और फलाना आयुर्वेदिक मेडिसिन. यार मेरा ठीक हो जाता है. अभी डॉक्टर के पास जाओ यार वो फालतू में 50 चीजें लिख के दे देगा. ये बोलेगा ये टेस्ट करो. Test has become a very normal norm with doctors recommending tests.
Yes.
So I think somehow there are a lot of people that trust factor has broken के यार you know फालतू में इनके सब के. And everybody knows about this that all these doctors now they have tie-ups with these pathology labs.
Right.
Or they have a cut that they'll tell you to go to that pathology lab and
Sure.
then whatever test, how number of tests, and the tests are also not cheap.
Right.
So बहुत चेंजेस हुए हैं. लोग हेल्थ पॉलिसीज खरीदने लग गए हैं बहुत ज्यादा.
Correct. I would still push back against that and say that testing तो है ही जरूरी. But even the fact that we think that it's a possibility that वो जरूरी नहीं है, it's because the government has put in the last budget 3,000 crores
into Ayush.
In Ayush.
Into Ayush.
So there are so many private and government practitioners, Ayush practitioners who are out there also that I think the fact that there is an other side to modern medicine that has emerged even more.
That's
in the
not
last
modern medicine.
Few years. That's not modern medicine.
That's not modern medicine. It's traditional medicine.
Versus
Ayurveda.
modern. Because 2014 the government gave 691 crores and last year it was 3,000 crores.
So there is, I think this trust thing which you just said, वो actually it's a function of both, right? कि एक तरीके से आयुष के जो डॉक्टर्स हैं उनको खुद के लिए कस्टमर्स भी लाने. I mean, like they want to also legitimize themselves. So it is also works in their favor if people start doubting like the other side of the table or whatever it is.
वही मैंने कहा ना कि ये आपका satisfaction. I just remember while talking a very interesting real किस्सा of my own.
Anup, can I pause you for a little second? We have to actually take a break, and after we come back from the break, you can tell your kissa.
Yeah, ठीक है.
Yes. Guys, after the break, Anup tells you his fun kissa. See you then.
Hello. It's been another great week on the IVM Podcast Network. We are back with the second season of How to Citizen, hosted by Meghnad and Shreyas. The first episode of second season drops on February 26th. And guess who is our guest? Omar Abdullah, former Chief Minister of Jammu and Kashmir. So catch the episode now on the All About Now feed on IVM, YouTube and all streaming platforms. On page 10, myself, Nikhil, Meghnad and lead editor of International Initiative at Your Story, Sindhu Kashyap, discuss income tax raid at the BBC offices, GCC countries investing in startups and more. New episodes are out on the All About Now feed. On Think Fast, Varun and Suchita discuss women's IPL auction, Air India's purchasing Boeing planes, and a series of other interesting things. On Vartalab, joining Naveen and Akash is singer and songwriter Nush Lewis. They talk about her music career and what it takes to create great music. And on Postcards from Nowhere, Utsav uncovers the history of the most beloved flowers known to mankind. Once again, don't forget to visit our merch store on the ivmpodcast.com website. We have some exciting stuff for you. Follow us on social media. We are IVM Podcasts on Twitter, Facebook, Instagram, and LinkedIn. If you like our shows, spread the word, tell your friends, and don't forget to rate and review them wherever you're listening to them. You'll also find all our shows on youtube.com/IVM Podcasts. And finally, we would like to thank our sponsors this week, Yono SBI, Capgemini, and HDFC Mutual Fund. Thank you for making this possible.
Hello and welcome back to How to Citizen. We are dealing with chapter 2 of the 7th grade civics book, and with us we have Anup Soni. And Anup Soni, before the break, was going to tell us a very interesting story. Go on.
So, जब हम बात कर रहे थे ना, that, you know, whatever suits you better.
Yeah.
So, I was studying in National School of Drama. And that was my first time living in hostel away from my parents. Obviously, there was a different routine.
Correct.
Food habits were different. And I used to have this stomach pain kabhi. And I remember when we were at home, since childhood, mother used to give us ajwain and namak, pick it and gulp it with water.
Right.
And within 15-20 minutes, you're fine.
Yeah.
So I applied the same formula whenever it happened. I went to the mess, my school, National School of Drama mess. And I went to the kitchen directly, or, you know, because it's not a typical engineering or medical student. We are very limited people.
Correct.
Like all 3 year students, first year, second year, 3 year, total 60.
Oh.
That's it. 20 students per class. That's it. So I used to go to the mess. लिया थोड़ा सा अजवाइन, थोड़ा सा नमक डाला, वहीं पे पानी पिया, ठीक हो गया. One day, I was in the kitchen and one of the cook, his name was Vikram. उसने मुझे देखा, सर ये क्या खा रहे हो? ऐसे नहीं, वो पेट में दर्द होता है ना, so my mother told me that ये अजवाइन और इससे ठीक हो जाता है, तो मैं ये खा रहा हूँ. He said ये जीरा है. And I was like, what? He said हाँ आप बोल रहे अजवाइन. I said तो अजवाइन कौन सा है? बोले वो जो छोटा वाला है वो है, ये जीरा है जो. तो मैं उतने सालों से हॉस्टल में जीरा और नमक डाल के खा रहा था और मैं ठीक हो जाता था. Can you believe that?
Placebo.
So what is the outcome of this is that one, that it is belief. Believe कि मैं क्या कर रहा हूँ. Other thing is that के जीरा भी अजवाइन वाला काम करता है. नई discovery. But I seriously believe in one thing, that, you know, as far as health is concerned, you know, it's a lot to do with your willpower,
Absolutely.
your how you feel, how you tell yourself that I'll be fine. It makes a, जैसे वो 50s में डायलॉग था ना कि अब दवा की नहीं दुआ की जरूरत है.
Yeah.
तो वो दुआ, यहाँ पे दुआ डिफरेंट तरीके से, that, you know, it's your willpower.
Correct.
You fight with a certain illness.
Yeah.
Absolutely.
हाँ, मतलब obviously there is a wound, उसको तो ठीक करना ही पड़ेगा. उसको देख दो, ठीक हो जाएगा. वो नहीं चलेगा, मतलब वो वाला एंगल भी नहीं चाहिए. अरे छोड़ दो, कोई बैंडेज कोई ऑइंटमेंट नहीं लगाऊंगा मैं, मेरा विल पावर से ठीक होगा. वो भी नहीं.
I just want to ask, how are you like when you get sick? Like, what's your willpower like? Bad?
I'm very bad, yaar. I'm very bad. And मतलब I just pray.
Yeah.
I always, ऐसी बात बोलनी नहीं चाहिए, लेकिन I will, यार कुछ ऐसे ही चला जाऊँ यार, जब जाना टाइम आ जाए ना, ज़्यादा कॉम्प्लिकेशन नहीं चाहिए यार. ठीक है.
Are you an angry sick person?
Not angry. I am irritable.
हाँ, irritable.
Angry कम, irritable ज़्यादा. मुझे ऐसा लगता है कि ठीक क्यों नहीं हो रहा यार, ये ठीक क्यों नहीं हो रहा यार,
काम पे जाना है.
क्योंकि अजवाइन नहीं है वो, इसलिए ठीक नहीं हो रहा.
और I start my medication immediately.
अच्छा.
I don't delay.
Modern medicine.
Whatever it is.
Whatever.
Oh, Anup, I had a question. It sounds bizarre, but I have wondered this, right? So, like, now when you were doing Balika Vadhu, right? So, shoot schedule must be like, must be shooting like multiple episodes in a day, or was it like single?
Not, it's never like episode. It is always the
scenes.
Number of scenes and the time.
Correct.
That you need an outcome of 20 minutes, of 22 minutes in television, जो भी होता था वो उस वक्त. You might be shooting different scenes from different episodes, but obviously the priority should be okay, this week's
Right,
the telecast, the
right,
target.
right.
But it's never like you shoot the whole episode in one day.
Right.
Because the locations are different.
But then if you take a leave or you get sick, so do they have to like leave? तो of course you can give advance warning. But if you get sick, फिर क्या होता था? Script बदल जाता था.
टेलीविजन में everything is possible यार. बोलो तो सही. मतलब वो बोलते हैं ना, वो joke था. There was a joke in television when these whole daily soaps started. I did only one daily soap mainly, बालिका. But ज़्यादा प्रोडक्शन को तंग मत करो, फोटो टांग देंगे तुम्हारा. फोटो टांग जाए, हो गया.
That's actually.
Yeah.
But तुमको तो अमेरिका भेज दिया.
मैंने तो बोला था मुझे कुछ कर दो. अब उन्होंने अमेरिका डिसाइड किया. बट हाँ, ये टेलीविजन में वो फर्क नहीं पड़ता.
In CID, the Ajat Shatru, you died or what happened? Like, did you go off the show or your show ended?
तो फिर एक दिन उन्होंने चैनल ने डिसाइड किया कि अब शो बंद कर देते हैं.
बंद कर देते हैं वैसे ही.
अजात शत्रु आउट ऑफ जॉब हो गया.
So did you have a finale or something then?
No, nothing like that.
Nothing like that.
I remember CID Special Bureau. I'm not exaggerating. Imagine the state of mind. We used to work 14 to 16 hours a day, 28 days a month.
Wow.
So there was Sharad Kelkar with me. Salil Ankola was also there. 4 days. Just 4 days before it ended, we were told, 4 दिन बाद बंद हो रहा है. The production house or whatever, whichever way, they also will care, ये भाग ना जाए इनको. But imagine after 4 days, you're sitting at home doing nothing. Suddenly, this is
an entire show goes
This is
off.
the beauty of this profession. You are like mad working 16 hours. अरे यार ये इधर से उधर फ्लाइट पकड़ के उधर जा रहा हूँ, उधर शूटिंग की, नाइट शूट, डे शूट, ये शूट. Suddenly कोई है ही नहीं, घर में बैठे.
Does it? Do you think it has to do something to your mind, right? Like just playing the same role so many times as a detective, as a person. Like, do you think that has happened? Like,
see, it's a very simple thing. Like somebody was asking me recently because it's been 3-4. See, I didn't do any fiction on television since 2014. Since I left Balika Vadu. There's no. So almost 8 years I've not done any fiction. So they said, oh, अच्छा अभी आप TV नहीं करना चाहते हो, you know, because I still get calls also. I said, नहीं, it's not. I said, अच्छा TV छोटा है, ये. I said, नहीं यार, मैं देखो, I'm an actor. I did everything. I did, as you said that, you know, मैं podcast भी कर रहा हूँ, मैं play भी करता हूँ. 18th December I'm performing, so I'll invite you for that.
oh, please.
At Andrews. So I do live performance also as an actor. I said, I don't want to do television right now because I personally feel that when I do a web series or a movie, you know, there is always a freshness that I finish one film, then I get into a new film, I wear new clothes, new actors, new co-actors, new director, new atmosphere, new location, everything is new. My role is different.
That's fun.
That's fun.
Yeah.
I said, I am not doing television right now because of the reason that if I do one show, that is minimum commitment of 1 year. 1 year is basic. And if fortunately the show is a big hit, 3-4 years gone.
Goes on, yeah.
So 3-4 years, I'm going to the same place, same faces, same co-actors, same clothes, same role. I'm not exaggerating. I stopped taking awards for Balika Vadu after a point.
Oh, really?
Because my logic was, यार every year because the show is still doing well. होता क्या है ना, award functions में जो चीज successful है, आप उसको award देते हैं. ठीक है, शुरू में अच्छा लगा, बालिका वधू के लिए बेस्ट सपोर्टिंग एक्टर अवार्ड और दिस अवार्ड टेलीविजन में जो भी होते हैं मिल गए. सेकंड ईयर भी ले लिए, थर्ड ईयर भी मुझे लगा कि लेकिन मैंने तो कुछ एक्स्ट्रा किया ही नहीं. मैं जो 2 साल पहले कर रहा था वो मेरी कोई ग्रोथ नहीं है. राइट. सो when I am working in television, मैं जाता हूँ, वो सीन करता हूँ, एक कैरेक्टर सेट हो चुका है. See, the excitement of doing a movie or a web series is this. So I said that's the reason यार, मुझे कोई television से वो नहीं है कि मैं, you know, I look down on television. Not at all. Television has given me a lot.
Absolutely.
But I think it's time for me to experiment with my work now.
Absolutely.
You know? And I'm an actor. My it's my passion.
Right.
So what is wrong if I want to do that? Yeah? I'm not looking down on anything.
Correct.
Tomorrow, if there is anything interesting.
Also, people evolve, right? With times, and you want to try something new, fun, fresh. Like,
So
course.
for me now, the routine is different. I'm used to. Earlier, there was a time when I used to work for 28 days a month, 30 days a month.
Right.
Abhi मैं 10 दिन काम करता हूँ, फिर
Correct.
5 दिन छुट्टी होती है, फिर 2 दिन काम करता हूँ, फिर 4 दिन छुट्टी होती है.
Correct.
I'm
That's
enjoying
true.
this
Yeah.
process.
That sounds nice actually.
Yeah.
That does sound nice.
And I'm doing a play, and I feel that doing a play also,
Yeah, absolutely.
I enjoy that. So
Yeah.
I get time for that also. तो
Yeah.
दोनों चीजें हो रही हैं.
Very
I
nice.
like to be busy in movies, in web series 30 days.
Correct.
But I want to spend 30 days now in good
Yeah,
roles,
yeah,
doing
yeah,
good
yeah.
roles.
Yeah,
That's
yeah,
it.
yeah.
And with variety.
Yeah. Anyway,
Now
coming back
we
to
should
this.
actually that I was leading up to this. This was a setup because
Achha.
would you like to play a character of this?
He
We
hasn't
were
done-
thinking we should do a dramatic reading of this. The cost of a cure. The comic that is there. So what do you want to play?
I can play Aman.
So
I'll play Ranjan.
ठीक है, you play Ranjan. ठीक है, I'll be the narrator.
Okay.
And other characters.
Huh.
Okay.
Done.
Aman and Ranjan are good friends. While Ranjan comes from a well-to-do family, Aman's parents have to struggle to make ends meet.
Hi, Aman. Good to see you back. How have you been?
I had viral fever and had to go to the hospital.
Oh, me too. I just got back to school on Monday. My daddy took me to see the doctor at the new hospital in Kingsway. It was really exciting. The building looked so posh. I thought it was like a 5-star hotel. Daddy said that that is because it's a private hospital with the best of facilities. Daddy had to pay 500 at the reception counter itself before he even met the doctor. There was nice music playing and everything was really clean and shiny. The doctor asked for many tests, but everyone was so friendly. The lady who took my blood for testing told me so many jokes that I forgot to feel the pain.
And have you heard the one about Batman on reality TV?
And after the test results came, we went back to the doctor. He looked through them and said everything was fine and I only had viral fever. He prescribed lots of medicines and rest.
And so, young man, this pink pill should be taken 3 times a day and the white tablet once before bedtime. That's for body ache. This one is a syrup. Don't worry, it's tasty.
Thank you, doctor. I feel better already. You see, I have been dying to tell you all about it. But what about you? Which hospital did you go to?
It wasn't as nice as yours at all. At first, Abba didn't want to take me because he said it would take too much time. And it really did. We went to a big government hospital. We had to wait in a long queue at the OPD counter. I was feeling so sick that I had to lean on Abba all the time. When our turn came, the doctor examined me and asked for a blood test. Then we had to go and stand in another long queue. People were crowding around in the testing room too. We got the test results after 3 days and went back to the hospital. There was a different doctor that day.
Show me his OPD card and the test results quickly, please. He seems to be suffering from a bout of viral fever. Nothing to worry about. All he needs is one fever-reducing medicine.
My hospital was really nice, but they gave me too many medicines and the whole thing cost me 3,500 rupees.
That much? My treatment cost just 150.
And he's thinking this. He's not saying this. He's thinking this.
podcast.
Yeah.
But did you realize one thing?
Yeah.
That what I was talking about, that syndrome?
Yeah, exactly. So many tests.
Syndrome
yeah.
and also the class difference that you were talking. It's like...
हाँ,
it's
मतलब वो तो है.
हाँ.
But दोनों को viral fever.
Yeah.
You know, so many things tie in, right? First, you were talking about your chauffeur and standing in line and all that stuff. Also covered here.
And another thing I realized while reading this, he told me that कि अरे वो फिर उस दिन गया तो वो डॉक्टर अलग था.
हाँ,
ये भी
हाँ.
Gotten it on point.
So I one day, like a few years ago, I had a massive stomach pain. Right? Usually तुम्हारी जैसी अजवाइन लेके whatever करता था मैं. तो गर्म पानी पी लिया, हल्दी, दूध, कुछ भी कर रहा था मैं, कुछ भी ट्रेडिशनल जो भी करते हैं. रुक ही नहीं रहा है. Realized something is wrong, right? And I am not a big, like hospital person. Like I freak out.
Yeah.
So what I did was I just got up and I went to a government hospital that is right beside my house. It is this big hospital, government hospital, but I went there. And वहाँ पे basically एक तो लिटा के रखा मुझे, फिर एक डॉक्टर आया, ऐसे किया, तेरा अपेंडिक्स फटने वाला है. And I'm like, what are you saying? And he said it in these words. I freaked out, okay? Like, I was like, what do you mean? It's like, कि हाँ, मतलब सूझ गया है, अभी पता नहीं कब तक होगा, फटेगा ये. I'm like, don't say that. And I had heard that people die if that appendix explodes. So I called up people. I called my friend. He came and he's like, why did you come here? You know, we should have gone to like a private hospital or whatever. And I'm like, कि अभी आ गए तो थोड़ा तो कुछ treatment कर दो. Line थी. Again, line was very bizarre. There was a bed line. Right, like so people who couldn't get up and like me who were like writhing in pain, उनको एक line से bed पे ही लिटा के रखा था. And then the doctor was there. And it took me a few hours to get there, right? And when I got there, this one was like, और भी test करना पड़ेगा, देखना पड़ेगा, फिर आपको तो operation ही करना है. Obviously कोई solution नहीं है. So then by that time, like one of the doctors I knew, they came and then they took me to AIMS. लग्गा लगाया, which is what happens in AIMS, and they took me to AIMS. And AIMS mein, it was beautiful. Another government hospital. It was amazing, right? You know, like they did like modern surgery. कोई scar भी नहीं है अभी. They immediately took me to the operation theatre. सब कुछ कर लिया. And the entire thing, I was there for 2 days. It cost me 320 रुपए.
Wow.
The entire operation से लेके treatment से लेके everything, with the best of facilities, it cost me 320 रुपए. I was blown away by the difference between that hospital and this hospital, which are both government funded.
But I believe AIMS is one of the best.
Oh yes, it is. Also, it is a traumatic place to be in. I mean, ek to obviously there are so many people trying to get into AIMS. We just knew a doctor there by chance, so we were able to do this. But I realized that day that bahar tent lage ho AIMS mein. If you ever go from that road, there are literally tents there where patients are sleeping, their relatives are sleeping, and they're trying to get inside that hospital. It's really sad.
I think AIMS get a lot of influx out of Delhi people also,
Yeah,
from different other states also.
Yeah.
Because for severe health problems.
Absolutely.
Yeah,
And as you said, it is the best treatment there.
Yeah.
I mean, and the doctors there are mad. Matlab, like they're going nuts. Like they're there all the time, and it's very stressful.
But somewhere down the line, I feel, you know, वो जो एक medical world में जो एक, I don't want to use the word insensitivity, but एक ruthlessness is, I can sense it, you know.
No,
somehow the value of life has gone down. I don't know.
But I feel they being doctors, they can't be emotionally involved. They have to be clinical about it.
You know, that's actually a good observation, because again, I'll take the example of my mother-in-law. Now, she saw deaths all the time, like in a hospital like that, government hospital, like deaths and injuries and, you know, blood and guts and everything all the time. It did, I think, over a period of time, turn her insensitive by default.
No, it was insensitive. I didn't mean by saying
desensitized.
Because she's part of
desensitized.
that.
Better way to put it. Yeah.
But what I mean to say is that I'm saying, say for example, if even a private hospital,
right?
Yeah, my experience in private hospitals also that they, अगर उनका बस चले ना, तो वो हर चीज के पैसे चार्ज कर ले आपसे.
Right.
मतलब कर ही लेते हैं वैसे तो. They do that also.
True. Yeah.
But you know, that's what I'm talking about. I feel that's the greed. You know, for example, it's a private hospital. You have spent in this. The Ranjan paid $300 at the reception.
Yeah.
I have paid 1,600 rupees just to show my son's ankle while playing football. He twisted his ankle.
Right.
1,600 rupees basic.
Right.
At the reception.
Correct.
What I'm trying to say is that you have a building, you have invested, you pay a good salary to your doctors or you pay good visiting fee to your doctors.
Right.
उसके ऊपर अपना एक थोड़ा profit margin का एक limitation रख लो. I'm not saying don't earn.
Yeah.
But I'm saying कि cut the cost ना. I personally feel it's like your greed is too big that you want to earn as much as possible in as less time as possible. That's coming back to intent.
Yeah. But do you think that's on doctors or do you think that's on corporations which are running
and
hospitals?
even doctors have told me that the corporations and the private sector is run by those hospitals are run by those corporate teams.
Yeah.
There's a pressure on doctors.
No, absolutely there is. I mean, धंधा है वो.
हाँ, मतलब literally doctors have. मतलब if you as a doctor don't get that kind of a business, you're out. You're not affiliated to our hospital.
Yeah.
There are many arguments I've gotten into with like policymakers, etc. So I used to work with MPs, I used to write their speeches, and there were these moments where we had these big arguments about whether the private sector should be involved in healthcare at all. Right, you know, because like NHS in the UK, like government runs a lot of, you know, like the healthcare, etc. And it's free. I mean, like it's practically free. And they make sure that there is like high quality education, healthcare given to all citizens. I feel like, I mean, sure, in India, there's a lot of population research crunch, etc. But in a default situation, I feel like the government needs to do that. I think at least 80% of all healthcare needs to be government.
Yeah.
Abhi, I feel like it's not the case. Private hospitals are allowed to do a lot of things which maybe other countries don't. It's tragic. I feel the same about schools.
Yeah.
I mean, I don't think there should be, like, to put it in a simple way, public utility, which is like basic needs, shouldn't be made for profit.
Yeah.
I don't think people should make profits over it. Or, as you say, there should be a limit.
There should. That's what I'm saying.
Put a cap.
There should be a limit.
There should be a limit.
There should be a limit. I think, if not, what you said is that 80% control of health sector or education sector, the government should control. I feel that if they can put a cap, you can't keep a hospital room more than this. This is the outer limit. So, you know, for example, okay, you say that, you know, you have a 5-star suite in your hospital.
Sure.
But there has to be a certain limit कि यार एक आपने बना दिया ना.
Yeah.
It's not a hotel.
Yeah.
It's not a hotel. So certain, you can't go. जैसे for example, Prithvi Theatre, when you go and watch a play, Prithvi has a set limit of a price for a ticket. You can't you can perform in Prithvi and keep a 2,000 rupees ticket.
Oh, they have a limit?
Yes.
Oh, wow. Okay.
They want that. Their purpose is कि they are not for
profit.
You can't go and book Prithvi.
Oh, okay.
You can't say, चलो हम अपना function करेंगे हम book.
No.
They'll give you a date. You will have to apply.
Okay, right.
And if they see a potential, because the purpose of when this Audi was made is to encourage theatre.
Right.
Encourage people to come and see theatre. So ये जो एक live art है बची हुई थिएटर उसको because अगर प्राइसिंग 2000 रख दोगे तो लोग आएंगे नहीं. 500 I think 500 is the outer limit. I don't remember I've seen any. So there is 400. It's up to you.
Right.
That's as a performer, as a producer, as a group owner or theatre group owner, it's your choice. But so यहाँ कहीं ना कहीं they have also
sure.
Don't you think Juhu people can afford 2,000 rupees ticket, or people coming from Bandra to watch a play? They will.
Yeah.
So even if Mr. Nasiruddin Shah is performing, or even if Mr. Anupam Kher is performing, or even Anup Soni is performing, or anybody else, Prithvi rates cannot go beyond a certain price.
Interesting. So essentially that same logic can be applied to healthcare. Yeah.
That's what I'm saying. Correct. कि अगर hospital में there is a room which is a twin sharing, चलो ठीक है आपने उसका एक certain cap रखा. उसके बाद एक single room हो गया, उसका एक certain. You can't have 20,000 rupees room in a hospital.
That's very true, and it's a bit ridiculous actually. And they actually call it a presidential suite.
Yeah.
And I have never understood this logic in private hospital. Never ever understood this logic. There must be something.
Yeah.
This is like, for example, there's a corridor. So there is like single room, then the suite, and then on the left hand side it's twin sharing.
Yes.
So this doctor is on a round.
Yeah.
For example, this particular round. So when he goes to the single room, there is a certain price for that. Do you know, as per the room you are taking, the list of your medicines, the list of the surgical equipments, the doctor's fees of visiting is different. So वो डॉक्टर अभी जब सिंगल रूम में घुसेगा, अगर उसका एंट्री हुई उसकी 2,000 रुपीज, वो जब स्वीट में जाएगा तो 5,000 हो जाएगा.
Oh,
wow.
Did you know about this?
No, I did not know about this. I mean, it also makes sense, but it also sounds very ridiculous. It does, yeah.
So उनको क्या लगता है कि भाई somebody who can afford 20,000 का room.
Yeah.
वो तो कर ही सकते हैं.
So वो
So does he then have to make like spend? I mean, incentive wise, if you look at it, for
it's
a
the
doctor,
same way. It's the same way. You travel in an economy class and you call the air hostess and says ke in an international flight, I want one more 16. She's like, after some time we are serving food now. And the same air hostess in business class, if you tell her that, excuse me, I want to have same thing. Should I make something new for you? Would you like to try another combination?
Attitude change हो जाता है. Like, that's actually true. That's really sad.
वो वाली बात है यार.
Hospital में you don't expect this to happen to
ये
you.
बोल लो तो अभी आप सोच लो ना, वो डॉक्टर जब ट्विन शेयरिंग में जाएगा, उसको 2 लोगों के साथ टाइम स्पेंड करना है
That's
उतने में.
Yeah.
जब स्वीट में जाएगा तो he'll spend more time. He'll talk about Indian politics and business and
That's right.
maybe he'll talk about the new some new model has come, car model has come, or new phone model has come.
Yeah.
That he's buying tomorrow.
Yeah, or maybe the patient has got, because he's affording a 20,000 room, तो उसके पास phone भी महंगा होगा.
Yeah.
That's really nice, sir. इस पे बातचीत होगी.
I find the idea of the small talk in those rooms being better hilarious.
मतलब मैं तो ये सोच रहा हूँ
better.
कि साला ये भी होगा कि यार ये डॉक्टर है और वो पता है ये तो बहुत ही बहुत बड़ा आदमी है. वेरी नाइस वन. सो डॉक्टर वो भी सोचेगा यार ये मेरा डॉक्टर है, मेरा पेशेंट है, इसको एक गिफ्ट ही कर देता हूँ कल. उसका भी इंटेंट ये होगा कि अरे सर आई लाइक दिस फोन सर, I'll try. You want? I'll send you one.
But still one. हाँ, say.
एक there is a very relevant line यहाँ पे which I would like to read out. एक तो पहले उन्होंने क्वेश्चन पूछा है टॉप में कि why did Rajan have to spend so much money? Give reasons. My answer here is late stage capitalism.
नहीं, मेरा आंसर इसके लिए था कि नाइस म्यूजिक, बिकॉज बैकग्राउंड नाइस म्यूजिक.
बैकग्राउंड में म्यूजिक लगा. the chapter में the line says the health service is called public for many reasons. In order to fulfill its commitment of providing healthcare to all citizens, the government has established these hospitals and healthcare centers. Also, the resources needed to run these services are obtained from the money that we, the public, pay to the government as taxes. Hence, such facilities are meant for everyone. So, this public word, I think, is very important here, right? Which we were talking earlier as well, ki public health. That's why they call it public health, right? And I think we should use the word public everywhere when we talk about health. But I think there are a few other things that I just wanted to quickly touch upon, and then we will end this. But there is this story, right, Anup, of Hakim Sheikh, which they speak about. So the story goes something like this, that Hakim Sheikh injured himself while riding a train, goes to like multiple hospitals and does not get treatment. And then eventually he files a case in court, right? And the conclusion to that is that the government basically, so the court says that the government has to safeguard his right to life, and the court says that the Hakim Sheikh had to face a lot of difficulties and had a cost to life. So the government can, if the hospital cannot provide timely medical treatment to a person, it means that the protection of life is not being given. And then they ask the government to compensate him for all the troubles. I cannot even imagine how much money the government will have to pay if everybody files a case like this.
तो वो फिर पब्लिक वाले हेल्थ सेक्टर को ठीक कर ले.
Actually.
उससे अच्छा तो यार ये पेमेंट करने से तो ज़्यादा, लेकिन उनको पता है. अच्छा,
just a final question for you, Anup. Like, are you happy with the way like you have been getting healthcare treatment till now? Did you have problems, or are you okay with it?
See, fortunately, touch wood, I haven't been hospitalized.
Yeah.
So मुझे वो experience नहीं पता, but obviously my near dear ones have been there.
Yeah.
So I have interacted. So this is my observation, that like I said in the earlier discussion, that when the bill comes to me, whether it's my mother in the hospital, यार ये इतने charges से नहीं, वो single room में इतना होता है,
right.
And then when you go to the insurance company to claim that, they don't pay you the full money.
Right.
So they say कि वो वो जो food आता है वो included नहीं है.
अच्छा.
ये तो आपको कभी you won't get 100%.
Right.
So उसमें surgical equipments में भी ना, this I came to know when my mother was hospitalized and when I sent the papers to my agent for claim. So ये पता चला कि ये surgical equipments में ये included नहीं है. इसमें ये included नहीं है.
Right.
ये loopholes जो है ना, these are problematic and these loopholes are there in every insurance policy.
Right.
Like for example, if you go for a car insurance policy, plastic का इतना मिलेगा, मेटल वाले का 50-50 मिलेगा, इसका 80-20 मिलेगा. वाह यार, इंश्योरेंस दे रहे हो ना, मेंटली फ्री कर दो यार, एक ही बार पूरा पैसा ले लो ना हमसे प्रीमियम यार.
That's true.
So I think this, I realized in medicals also, when you are giving an insurance, at least somebody's paying a huge premium amount for the health insurance. गाड़ी तो चलो separate चीज़ है यार, वो तो it's a materialistic thing.
Yeah.
Health is the most important thing.
Correct.
Absolutely.
We are living, we want to live as many years as possible. We want to live healthy. We want to enjoy our life.
Right.
वहाँ cheat मत करो यार.
वहाँ पे नहीं cheat.
पैसे अगर problem क्या है, somewhere I feel that पैसे लेके भी cheating हो रही है.
Absolutely. And one good thing though, I think it's coming now in government also in the last few years, a decade. More or less, they are encouraging people to get more insurance. Even the government is providing insurance, like 5 lakh rupees ka for a family or whatever. So when I was covering elections in West Bengal, it was actually very interesting to see how the woman of the household, the eldest woman of the household, was getting insurance card made in her name. This was a Mamata Banerjee scheme, and it was wildly popular. Like that back then. ये तो पैंडेमिक के पहले की बात कर रहा हूँ मैं. Wildly popular scheme, and primarily Mamata Banerjee won because of that one scheme. Because I spoke to so many people who were like, कुछ सालों पहले जब हमें कुछ भी होता था और हम हॉस्पिटल में जाते थे, तो it pushed them in poverty again. तो मिडिल क्लास में आ जाते थे कुछ ना कुछ करके, and then like one accident happens and everything is over. For years they are in debt, right? So this one coverage of like 5 lakh rupees, तो कोई भी हॉस्पिटल में जाओ तो आपको treatment मिलेगा और insurance मिलेगा. It's a big thing that the government is doing. I think Modi government is also doing it. A bunch of state governments are also doing it. I'm really happy that awareness is coming.
Yeah. But I would like to say that right now, I was reading this scroll article about how in Uttarakhand there's a tuberculosis problem happening right now. And there are many people complaining that, the government has promised 500 rupees per month to them, but it's not coming and people are really depressed.
Of course.
So again, that's the thing, that like you're making laws, but like is the implementation there?
Implementation
The
is
intent.
also
The intent.
Yeah.
Yes.
See, even if the political party who's ruling the country is ready to give something, but if it's not reaching,
correct,
then there are people in the middle.
Absolutely.
See, I'm sure that when we talk about public health sector, I'm sure government must be allocating a huge amount for that.
Yeah.
Governments are allocating huge amounts for years.
Correct.
Present government also, earlier governments also, they must be allocating a lot of amount. But the problem is midway there is, and if those people can somehow
Let go.
Yeah, seriously, let go that greed.
Yeah.
Before I finish this, I'll tell you one joke I remember. This is a joke I've heard. That, our Indian, you say administrative officers or politicians or whatever you say, people who are part of the system,
correct,
they go abroad for some seminar, and after the seminar there is a dinner at one of their local counterparts' house, and they go and they say, house is brilliant, man. It's so posh. And say, you guys earn a lot of money here. He said, come here. He takes him to the window and he says, can you see that flyover? He said, yeah. He said, 10% of that flyover is mine. Okay. So, cut to, the same thing happens in India. And they come to India, and after the seminar, Indian people, those heading the system, takes them for the dinner at one of the guy's house, and they realize, his house is also very big and important. He says, in India also you guys earn a lot of money. He says, come here. Takes him to the window and he says, can you see that flyover? He said, no. He said, 100% is mine. So my logic is, I personally feel greed, ठीक है, ले लो यार 10%, 20%. लेकिन यार अगर एक गवर्नमेंट ने एक ह्यूज अमाउंट एलोकेट किया है फॉर पुअर पीपल इन हेल्थ सेक्टर, उसका 10% खा लो, राइट. 90
इम्प्लीमेंट तो इम्प्लीमेंट कर दो, राइट. 90 मत खाओ और 10% दे रहे हो, ऐसे मत करो,
वो मत
please.
करो.
थोड़ा सा कंट्रोल.
Here's a plea by Anup Soni himself to everyone in power: let go of your greed.
Yeah.
I know you've been waiting for one message from
10%
the universe.
ले लो, 10%
ले लो, 10%.
And that is the host of Crime Patrol, friends. That is what it is. But thank you so much, Anup. I hope you had a good time.
Thank you.
Really
This was
good.
delightful.
Yeah. And
हमने बहुत सीरियस बातें हंसते हंसते कर ली.
you know guys, so he called me yesterday, we had this talk and he was very worried that this is going to be a serious topic and we are going to talk about it, but that's the idea of this podcast, right, Anup? Like, we did start off in a serious note, we did have a conversation seriously, but then towards the end we are also like letting loose and we are also like talking about other stuff.
Absolutely.
And I think that's a good lesson for you 7th graders. So please keep following this podcast. Please keep listening to How to Citizen. And next week, we have a very, very fun guest for you.
Oh, yes.
Yes.
It's that guest.
It's that guest. It's that
so
guest.
excited.
Yes.
Funnier than me.
Thank you so much, Anup.
Thank you so much.
Thank you.
Thank you.
Yeah.